Hi friends, welcome back to Complete Medical Coding. Today let's discuss about the integumentary system. Integumentary system, it represents the human skin. So it is the organ system comprised of the skin and other associated structures and appendages. There are a few guidelines that we need to notice while coding for the integumentary system. So integumentary system is the one series. The code range of the integumentary system ranges from 10021 to 19499. And the coding is mainly based on the anatomical site and the calculation. So each and every system, each and every chapters, there will be a separate series, code series. Integumentary system will be for one series. The next will be musculoskeletal system, it will be 2 series. Then later digestive system 3 series. It will go on like that up to 9 series. So here let's discuss about integumentary system, which is one series. The range is from 10021 to 19499. Now biopsy. There are 3 types of biopsy: tangential, incisional and punch biopsies. Tangential biopsy is performed with a sharp blade to remove a sample of epidermal tissue. For example, a scoop or a shave, sausage, curette. A little scoop, a little amount of sample of epidermal tissue has been removed and performed the biopsy. That is called as a tangential biopsy. Incisional biopsy is performed with a sharp blade to remove a full thickness sample of tissue. Full thickness sample of tissue has been removed for the incisional biopsy. Now punch biopsy. Punch biopsy requires a punch tool to remove a full thickness sample. So punch biopsy requires a punch tool to remove a full thickness sample. That's also a full thickness sample. Now shaving of epidermal lesions. While reporting shaving, any shaving procedure, we need to check the anatomical site. So if it is the same anatomical site, we need to add the measurement and then we need to code it. For example, shaving of trunk 1 centimeter and arms 1 centimeter. So the anatomical site is the same. So we need to add both trunk and arm. It's the same anatomical site. So we need to add to get 2 centimeter. So the code will be 11302. If you check in the code book 11302, lesion diameter 1.1 to 2 centimeter. Up to 2 centimeter, we need to code this one, 11302. But if you move to excision, if the question is regarding excision of the same anatomical site, then we will not add, but instead we will give it as 2 separate codes. The same example we can take, trunk 1 centimeter and arm 1 centimeter. Then the code will be 11401 and 11401, because we need to, even though it is the same anatomical site, we will not add it as 2 centimeter. Instead, we will mark it as 2 separate codes because both are 1 centimeter. So up to 1 centimeter, we are using the code 11401. So we will code it twice. Next, excision along with simple repair won't code separately. Excision and a simple repair we will not code separately because the excision code is already included in the simple repair. So we will code separately for excision only if it is intermediate or complex repair. Now if we move to adjacent tissue transfer, all excision code is included in the adjacent tissue transfer. All excision code, it is already included in the adjacent tissue transfer. So we don't have to code excision and adjacent tissue transfer separately. Now repair or closure. There are 3 types of repair. These are the other names: simple repair or layer closure, intermediate repair or layered closure, complex repair or extensive. Now what about benign lesion? There are 2 different lesions, benign and malignant lesion, and other names: fibrous benign lesion, also called as fibrous, inflammatory, congenital. If any of these words are coming, it means it's a benign lesion. For malignant lesion, it can be melanoma, basal cell carcinoma, or squamous cell carcinoma. Now, destruction. Destruction can be benign or pre-malignant. Another name for benign is pre-malignant and then malignant. Destruction and excision is having the same guideline. We will not add if it is the same anatomical site, but we will use the separate codes. Same like excision. Now, skin replacement surgery, which is called as grafting. There are 4 different grafting: split thickness graft, epidermal graft, dermal graft, and full thickness graft. First, we need to check if the grafting is done for an adult or for a child. If it is done for an adult, then the measurement will be in centimeter. If it is mentioned in percentage, it means the grafting is done for a child. Sometimes in some questions, they might not mention if it is an adult or a child, or they might not mention the age. They will just mention the measurement. So if it is in centimeter, it means it's done for an adult, and if it is in percentage, it's done for a child. Now, MOH micrographic surgery. Here also we will check this is an important part, we will check the 3 important sites: anatomical site, number of stages, and number of tissue blocks. For number of tissue blocks, default we will use the code 17315 if there is any question which is related to number of tissue blocks. After coding everything, we will use 17315 as an add-on code for representing the number of tissue blocks. We'll see the examples later. And few anatomical names. Ectomy means removal, plasty means repair, as you already know. Now let's move on to some practice questions. The first question: physician excised a 2 cm squamous cell carcinoma from the forehead. The total excision, including margins, was 3 cm in diameter. What is the code? So here they have already mentioned the total excision as 3 cm diameter. So it's simple. If you will check the code 11643, you can check in the index page. Through the index page only you will get the codes. And for the examination, they will give multiple choices. You can check one by one codes. So if you can go to the index page, squamous cell carcinoma, then move to excision. If you will see the question as excision, it means it's a skin related question. So it will come under, the code will come, definitely it will come under 1 series code. So if you will check the code 11643, it's mentioned excise diameter up to 3 cm, 2.1 to 3 cm. So our total margin is, diameter is 3 cm. So this will be the code. Next one, code for wide excision of a malignant lesion of arm 3 into 2 cm with adjacent skin graft. This is adjacent skin graft, which means this question is related to adjacent tissue transfer. So 3 into 2 cm means 6 cm for the adjacent tissue transfer. So for 14020, the adjacent tissue transfer or rearrangement, you can go to the index page, take adjacent tissue transfer, you will get this code and check for the size. It is less than 10 square centimeter, right? So 3 into 2, 6 centimeter only, 6 centimeter square. So less than 10 centimeter square, we will use the code 14020. Now, code for aspiration of 2 cyst breast. 2 cyst aspiration. Cyst aspiration, we will use the code 19000 because it is 2 cyst. The first cyst code will be 19000, and an additional code we will use the code 19001. 19000 is the puncture aspiration of cyst of breast, and each additional cyst will be represented by an add-on code 19001. Next question. The physician performs a punch graft for hair transplant. He uses a punch tool to remove a small segment of scalp containing hair and hair follicles. This is transferred and inserted into non-hair bearing area. Code 419, punch graft for hair transplant. So here the question is about punch grafting. So we need to go to the punch grafting. There you will get the code 1577077576. So here the number of punch graft is 19. So for more than 15 punch graft, we use the code 15776. Next is an important question. This is the one regarding the tissue blocks, which I had mentioned earlier. The tissue blocks. The patient presents with a squamous cell carcinoma of the nose. After prepping the patient in site, the physician removes the carcinoma, which is the first stage, and divides the stages into 6 tissue blocks for examination. So under first stage, the number of tissue blocks is 6. Upon microscopic examination, the physician finds there are positive margins. He removes the positive margin with another excision, which is the second stage, which is divided into 3 tissue blocks for examination. So first stage is 6 tissue blocks, second stage is 3 tissue blocks. Upon microscopic examination, the physician finds the margins are negative. What will be the code? So here we need to check the stage wise and the number of tissue blocks. Number of tissue blocks, we will use the code 173315 as an add-on code. So this is MOH micrographic surgery. It comes under micrographic surgery. So if you check the code 17311, MOH micrographic technique, including removal of all gross tumor, etc., it is mentioned as, at the end it is written first stage up to 5 tissue blocks. So up to 5 tissue blocks, we will use the code initially 17311. So we have 6 tissue blocks on the first stage. So we will put this code 17311, and the remaining is how much? 1 tissue block. And how about the second stage? 3 tissue blocks. So 3 plus the remaining 1 from the first stage. So 4. Like that we need to calculate. So total remaining is 4 tissue blocks. So we need to code the next one. Each additional stage after the first stage up to 5 tissue blocks. So again up to 5 tissue blocks we will use the code 17312. So it is finished. Up to 5 tissue blocks, we have only 4. So the coding is finished. 17311 for the first 5 tissue blocks and 17312 for the next balance remaining 4 tissue blocks. And then we will use the code 17315 for the number of tissue blocks used. If you can check the code 17315, you will get to know. It's written the number of tissue blocks, including removal of all gross tumor. That is the number of, for representing the number of tissue blocks, we will by default use the code 17315 as an add-on code for all these type of questions, all these type of tissue transfer tissue blocks procedures, questions. So hope you understand this. These are just a simple practice questions that comes under integumentary system. So if you have any doubts or any queries, you can please mention it in the comment box. And next we will move on to the musculoskeletal system. That is the 2 series, which I'll be taking it in the next chapter. I don't want everything to mix it together. That is why I'm taking small chapter wise, the basic things and the practice questions chapter wise. And then later we will combine it with the ICD code book. ICD and CPT we will combine after finishing all the chapters. Then we will move to the exam questions, practice exam questions. So which will be useful. It will be easy for you to learn, especially for the beginners. So friends, that's all for today. That's all for the integumentary system. So thank you so much. And if you like the video, please share it and support me. And please subscribe my channel. Thank you so much. Bye. See you in the next episode.